The antihypertensive drugs which are used in the pregnancy, number one, alpha and beta blockers, calcium channel blockers, alpha blockers, vasodilators where hydralazine hydrochloride is used. The antihypertensive drugs contraindicated in pregnancy are ACE inhibitors, minoxidil, sodium nitroprusside, diltiazem, atenolol, and propranolol. These drugs should be avoided because they may or can cause poor fetal renal function, malformation, or can cause IUGR. Labetalol hydrochloride. The preparation of labetalol hydrochloride is that it comes as an injection as a 5 mg per ml into 20 ml vial. As a tablet, it is available in three different dosages: 100 milligrams, 200 milligrams, and 300 milligrams. The action of labetalol hydrochloride is that it reduces the peripheral vascular resistance as a result of alpha and beta blockade. The indications for this medications are hypertension and hypertensive emergencies. The contraindications are hypersensitivity to this drug or to its components, bronchial asthma, hepatic or heart failure, prolonged hypotension, and severe bradycardia. The adverse effects of this medication includes dizziness, fatigue, nausea or vomiting, headache, vertigo. The dosage and route of administration, it is given as a 50 milligram or 100 milligram tablet once in a day orally, or as an injection 20 milligram per 20 ml injection as an IV bolus. Wait for 10 minutes. If there is no response, then the remaining 40 milligrams is given as a slow bolus. When this medication is given, the nurse has to consider and advise the patient to remain in supine position for 3 hours after the infusion. The patient's BP has to be monitored frequently. In a diabetic patient, the glucose level should be monitored very closely. Advise the patient that dizziness can be minimized by rising slowly and avoiding sudden position changes. The next medicine of choice is nifedipine. The preparation comes as a capsule as 10 mg and 20 milligrams, tablet 20 milligrams, 30 milligrams, 60 milligrams, and 90 milligrams. The action of nifedipine is thought to inhibit the calcium ion reflex across the cardiac and smooth muscle cells, decreasing the contractility and oxygen demand, and also dilates the arteries and arterioles. The indications of nifedipine: hypertension, classic chronic stable, angina pectoris. The contraindications: heart failure, hypotension, severe GI narrowing. And the adverse effects of this medication includes dizziness, syncope, heart failure, muscle cramps, peripheral edema. The dosage and route of administrations: 5 to 20 milligrams once in a day orally. The nurse has to consider and monitor the BP and heart rate regularly. Advise the patient to avoid taking this drug with grapefruit juice. Watch for symptoms for heart failure. Advise the patient if chest pain worsens immediately, report to the doctor. Methyldopa is another drug of choice, and its preparation is available as a tablet and an injection form. As a tablet, it is available in 250 milligrams and 500 milligrams. The action of methyldopa is that it inhibits the central vasomotor center, decreasing the sympathetic outflow to the heart and the kidney and peripheral vasculatures. The indications of methyldopa is hypertension, hypertensive crisis, and the contraindications: hepatic disease or liver cirrhosis, lactating mothers. And the adverse effects of this medication is decreased mental acuity, sedation, headache or depression, bradycardia, hepatic necrosis, hepatitis. And the dosage of routes of administration of methyldopa is 250 milligrams BD or TDS, maximum up to 2 grams daily, titrated by BP. And the nurse has to consider to monitor the BP regularly, monitor patient's Coombs test result, report for involuntary movements, tell the patient to check the weight daily and notify if she gains 2 or more pounds in a week. Hydralazine hydrochloride is the next drug of choice. The preparation is available as an injection 20 mg per ml in 1 ml vial, and as a tablet it is available in 4 different dosages: 10 mg, 25 mg, 50 mg, and 100 mg. The action of hydralazine hydrochloride is that it directs the acting peripheral vasodilator that relaxes the arteriolar smooth muscles. The indication of hydralazine hydrochloride is hypertension and severe essential hypertension. The contraindications: coronary artery disease, rheumatic heart disease, stroke, severe renal impairment. The adverse effects of this medication: neutropenia, leukopenia, thrombocytopenia, orthostatic hypotension. The dosage and route of administration: it is given as a 25 mg tablet BD and if necessary may increase to 50 mg BD. 5 mg diluted in 10 ml of normal saline slow IV is given at the rate of 15 to 20 minutes interval. The nurse has to consider to monitor the patient's BP, pulse rate, body weight frequently. Monitor the patient for muscle and joint pain, fever, or throat pain. Advise the patient to take drug after food to increase its absorption. Diuretics. These are the drugs used in the following conditions during pregnancy: pregnancy induced hypertension with massive edema, eclampsia with pulmonary edema, severe anemia in pregnancy with heart failure, prior to blood transfusion and severe anemia, and as an adjunct to certain antihypertensive drugs. Furosemide, Lasix. The preparation is available as an injection in 10 mg per ml. As a tablet, it is available in 4 different dosages: 20 mg, 40 mg, 80 mg, and 500 mg. The action of this medication is that it inhibits the sodium and chloride reabsorption at proximal and distal tubules and loop of Henle. The indications include acute pulmonary edema, hypertension. The contraindications include anuria, hepatic cirrhosis, allergic to sulfonamides. The adverse effects are, in the case of maternal, weakness, fatigue, muscle cramps, and hypokalemia. In the case of fetal, it may occur due to decrease leading to fetal compromise, hyponatremia. The dosage and route of administration: as a 40 mg tablet daily following the breakfast. In acute conditions, the drug is administered parenterally in doses of 40 to 120 mg daily. Nurse has to consider to monitor the weight, BP, and pulse rate routinely for long-term use. Monitor the patient's input-output chart. Watch the signs for hypokalemia such as muscle weakness and cramps. Monitor the uric acid if the patient is having gout. Advise the patient to take the drug in the morning after the food. Advise the patient to avoid direct sunlight to prevent photosensitivity reactions. Tocolytic agents. These drugs can inhibit the uterine contractions and used to prolong the pregnancy. In women who develop premature uterine contractions, in addition to putting them to absolute bed rest and sedating, tocolytic drugs are administered in an attempt to inhibit the uterine contractions. Here are the drugs used: isosuprine hydrochloride and ritodrine hydrochloride. Let's see them one by one. Isoxsuprine hydrochloride, duodenine. The preparation is available as a tablet in 10 mg and as an injection 10 mg per ml is available. The action of isosuprine hydrochloride is that it acts directly on the vascular smooth muscle, causing the cardiac stimulation and uterine relaxation, and thus causing the relaxation of the veins and arteries and making them wider to increase the blood flow to certain parts of the body. The indications: prevent the preterm labor and to inhibit the uterine contractions. Contraindications include hypersensitivity. Adverse effects are hypotension, tachycardia, nausea or vomiting, pulmonary edema, cardiac arrhythmias, hyperglycemia or hypokalemia. The dosage and route of administration initially as an IV drip 100 mg and 5% dextrose to continue at least 2 hours after the contraction ceases, as a maintenance intramuscular 10 mg hourly 6 hourly for 24 hours, or as a tablet 10 mg 6 to 8 hourly. Nurse has to consider to assess the patient's BP pulse during treatment. Take the BP lying and standing, as orthostatic hypotension is common. Monitor for intensity and length of uterine contractions and fetal heart sounds. Advise the patient to make position changes slowly, as fainting may occur. Ritodrin hydrochloride. The preparation is available as an injection in 5 ml ampule, 10 mg per ml, which is equal to 50 mg per ampule. Tablet is available in 10 mg. The actions of ritodrin hydrochloride is that it acts directly on the vascular smooth muscle, causing the cardiac stimulation and uterine relaxation. The indication: it prevents preterm labor, and the contraindications include hypersensitivity, eclampsia, hypertension, and dysrhythmias. The adverse effects are hyperglycemia, headache, restlessness or sweating, chills and drowsiness, nausea or vomiting, altered maternal and fetal heart tone and palpitations. The route and dosage of administration, as in initially as an IV drip 100 mg and 5% dextrose at the rate of 0.1 mg per minute. Gradually it is increased by 0.05 mg per minute to continue for at least 2 hours after the contraction ceases. As a maintenance, a tablet which is 10 mg 6 to 8 hourly per oral, 10 mg given half an hour before termination of IV, then 10 mg every 2 hours for 24 hours, then 10 to 20 mg every 4th hourly, not to exceed 120 mg per day. Nurse has to consider to assess the maternal and fetal heart tones during the infusion, and also intensity and length of uterine contractions. Monitor the fluid intake to prevent the fluid overload. Discontinue if this occurs. Administer only clear solutions after dilution of 150 mg and 500 ml of D5 or NS. Give at the rate of 0.3 mg per ml by using infusion pumps, or monitor it carefully. Positioning of the patient in left lateral recumbent position is used to decrease the hypotension and increase the renal blood flow. Advise the patient to remain in bed during the infusion. No drug should be administered to a woman during pregnancy, labor, and birth unless the woman is fully informed of the known risks and the relevant areas of uncertainty regarding the effects of the drug on the physiologic and neurologic development of the woman and her baby. The drugs that are used daily in obstetrics can have a huge impact on the outcome of both the mother and the child. Therefore, obstetric providers need to have a very clear understanding of the mechanism of action, doses, and side effects of the most commonly used drugs.